here on Facebook. We are live. All right. Welcome, everyone, to another episode of the Expect Miracles podcast. Thank you for tuning into this live episode. We have a very special guest today, Dr. Lee Angle. He is a Blair Upper Cervical doctor in Fort Myers, Florida. Dr. Lee, you've been doing this for about 10 years or longer?
We're up to 12 now.
12 years. All right. Okay. Perfect. And Dr. Lee has one of the most amazing recovery stories you will ever hear. He's got a great book that I'm actually going to read the first page. It's called My Dirty Little Secret. Usually I start off with a regular intro, but the first page of this book is so captivating. I wanted to just read it to you, and then we could start the show from there. So, Dr. Lee, if you don't mind, I'm going to start reading the first page. All right. We had as I was telling you before, we had a very similar story. Mine was from concussions, and we'll jump into yours here. I was 31 years old, and the picture of health: 245 pounds of muscle, top 20 in my weight class in the country for powerlifting. I held a state record squat. I ate cleaner than anyone I knew. Underneath it all, I had a dirty little secret. I was physically and mentally broken. It took me 10 minutes every morning to unfold myself and stand up. Once up, I had to hobble around on crutches for 30 to 45 minutes until I was able to put weight on my left foot. Otherwise, I would get a pain so severe in my ankle, I would times vomit. This was my daily routine for almost 10 years. I suffered from weekly migraines, seemingly endless sinus infections, and more days than not, I had burning sciatic pain down my left leg. My digestion was awful. I had debilitating lower back cramps. I had to put carpal tunnel braces on both hands. You know, the ones with metal in them to keep your hands straight. If I didn't, I would wake up sometimes during the night feeling like I dipped my hands in fire. All of that was just on the physical side. My mental abilities were deteriorating at an even faster pace. I had always been the top of my class, a social butterfly, and comfortable in almost any situation. I now found myself on Zoloft for my depression and anxiety, with OCD, which would allow me to use a toothbrush that wouldn't allow me to use a toothbrush more than once or step on a crack on a sidewalk. I felt like I was losing my mind and my body was almost gone. At this point, I had nearly given up on the idea of a happy, successful life. It was just a race to see which would fully collapse first, my brain or my body. I had tried medications, I tried therapy, even went to chiropractors for years. I ate like an Olympic athlete and exercised like a madman. Yet there I was, feeling close to hopeless. Dr. Lee, that is a hell of a beginning to a recovery story. You went through that for 10 years?
Pretty much. When I was around 18 or 19 is when things really started to go downhill. That's when the ankles started to be bad. The sinus infections started. I just get spontaneous nosebleeds just standing around. I was exhausted all the time. My grades in school started going downhill. And then as my 20s went, it all just kept adding on piece after piece after piece.
Jeez. And I was telling you before, I kind of had an idea with what was going on with me because I had an ice hockey concussion. And there was like an incident where I was like, okay, this happened. That's why I'm getting these symptoms. You must have been panicking because it just sounds like your health was just, there was really no rhyme or reason. You were just like going downhill. You must have felt like you were dying.
I really did. I mean, I'd played sports and beaten myself up a lot, but there wasn't, like you said, right? Like that one moment that changed everything. I just progressively, in our intake forms, you got check boxes, right? I just seemed like all the time, every month, every year, I was checking more and more and more things off. And it was just going downhill. And I had always, I think I said it in the book, I'd always morbidly joked by the time I was 50, I would either be in a wheelchair or a mental institution. And it would probably be more likely that I was getting wheeled around in the mental institution because I just, like I said, my brain and body, I think the brain stuff was probably almost worse than the body the longer we got. But yeah, it just progressively just nosedived.
So what did you originally, when things were getting bad, what did you try to do to get your health back?
I mean, I was competing in powerlifting, so I exercised all the time. I cut I changed diets. I cut out anything that you shouldn't eat ever out of my diet. I drank gallons of water a day. I mean, like we said, I tried the Zoloft, and I tried 5, 6, 7, I can't remember, multiple other meds. Zoloft was the only one that at least calmed a lot of the anxiety. I mean, I became a zombie. I gained a bunch of weight. I just sat around staring, but at least it calmed some of the other stuff down. And it started to bring the OCD level down a little bit, because that had just gotten to where it altered my life. I had to count my steps in a room, the toothbrush thing. I physically could not use a toothbrush more than once. If I tried, I would gag. I mean, I would have to throw it away.
Wow.
I hate to keep saying throw up, right? But I even threw up a couple of times because I was mentally, I wanted to force myself to do it. So the Zoloft kind of calmed that down. I started going to a chiropractor when I was 15. I guess that was the first thing I had. I had these horrible mid-back spasms that sometimes would put me on the ground, and I would just have to lay there until it would let go. That's when I started going to a chiropractor.
At 15 years old, you were getting those?
At 15, yeah. That was the first real like physical symptom that kicked in before everything else developed. So I went to chiropractors, general chiropractic, for years. I had a million massages. I tried acupuncture, physical therapy, the meds. There wasn't any sort of surgical option, right? There wasn't anything other than the ankle that was so pinpoint. And I had finally just about given up on those things. I think I still went to the chiropractor a little because I hoped that lifting wise, maybe it would help salvage something there. But for the most part, I had just given up and thought, well, I mean, this is it. This is what I'm doomed to, so to speak.
And so how did you end up in an upper cervical office?
So I was about 30. My life was
Oh,
terrible.
wow.
Yeah, I was
Okay.
older.
Damn.
Yeah, so by the time I'm 30, my life was going nowhere. I had no money, I didn't have anything. And my mom was a teacher. Education was always a big thing. I'd always done well in school until later on, my brain didn't work anymore. And I somehow decided I'm going to go back to school. Maybe that's what'll salvage my life. I think I was so altered at that point, had been altered for so long. I didn't really realize how internally messed up things were, right? If you are in a state long enough, you start to lose it. So there was an osteopathic school about 20 minutes from me. I thought about that. I thought about physical therapy school. Someone said to me, well, you ought to go be a chiropractor. And I thought, well, the chiropractor I go to, I wasn't really getting any results so much, but he was a really nice guy. He had a great business going. Everybody loved him. Who doesn't want all that? So I up and decided to go to chiropractic school. I put honestly very little thought into it. I needed one class to get in that had everything else. I showed up at Sherman. And although I had gone to chiropractors for, at that point, close to 15 years, we had a philosophy class with Myron Brown. And that was the first day I really heard what chiropractic was supposed to be. It wasn't just neck and back pain. It wasn't mechanical. There was so much more to it. We got to the fourth quarter. We had a class called Upper Cervical Rationale, and Dr. Perry Rush, who has been a old school Blair chiropractor forever, taught the class. And the more he talked about it, I thought, man, this is different. This isn't what I've heard before. And I've said this to my patients 1,000 times. It made more sense to me that one central thing was wrong and messing everything else up than I magically had 500 different systems that weren't working correctly, right? So I said, hey, do you take students as patients? And I started going to being a patient. And that's how I wound up in an upper cervical office.
How did his practice work? Was he a full-time teacher, or was he just teaching that one class?
He was a little half and half. I mean, he taught a good bit, and then he had an office out sort of hooked off the extension of his house.
And oh, that's awesome. I love that. And what was your first upper cervical adjustment like? Some people have that amazing first adjustment. Others, it's a little bit of a roller coaster until they start getting anywhere.
So the first adjustment, he put me in the resting room. I got a splitting headache, like right here. Actually, I was happy because something happened.
Yeah, right.
I had that headache for 3 days. The first month I went through, almost nothing changed.
Wow.
Two things were better. And this was a huge one. I wasn't on my crutches nearly as long in the morning, because that was normally half hour to an hour every single day. If I went on a trip, I had to take crutches with me. And my left hand, rather than being, had 3 stages: numb, tingling, or set on fire. It stopped being on fire and it wasn't numb 24 hours a day. Outside of that, almost nothing to me was measurably different. I think
Wow.
looking back, maybe my brain was starting to work a little bit better.
Were you a
So I
little
held the
bit
first
discouraged
adjustment.
or disappointed at that point? Or, I mean,
I, I think probably I think the only thing that saved me was I was in chiropractic school and getting chiropractic philosophy poured into me every day. So I kept thinking, but I also kept thinking if this doesn't work, I mean it's the only thing left, so let's give it a shot.
right.
So that first
And was he
adjustment,
kind of educating you like, this is going to take some time, hang in
absolutely.
there? Yeah.
Yes, very much. Yeah.
Yeah.
And I knew he wasn't worried about it, right? He wasn't worried that I got an adjustment and life didn't change.
Right.
So the first adjustment lasted a month. Then
Mhm.
I got adjusted again. The second adjustment held for 3 months.
Mhm.
That was an incredible 3 months because as much pain as I had been in before, double or triple it because everything started to change. I couldn't sit, I couldn't stand, I couldn't lay down. My hips felt like if you had tapped them, they would have shattered like glass. I think I probably complained then and was a little, and it was hard to sleep. But part of me was excited because I'm like, well, nothing else, all the other adjustments didn't make anything change. Nothing else I did ever made anything change except gradually getting worse.
Mm.
Suddenly now I feel awful everywhere. Maybe something good has happened.
Oh my God.
And during that period, I did notice that suddenly my grades were starting to go up because I almost failed out of school the first couple quarters. I couldn't remember anything. I couldn't focus long enough hardly to study. And what I did study, I couldn't remember.
Mhm.
Then it seemed like, oh, I read something, I retained it, right? My grades started to go up with a little bit less effort. And by the time, and I say on the book says 120 days, and it really is true. About 4 months in, all of that pain that had ramped up now was almost totally gone. I didn't have remotely the kind of limp I had. I wasn't on crutches anymore. I could study, take a test, and do well, and not study, for 3 days straight to remember four things. I
Yeah.
got rid of the carpal tunnel braces. I probably used a toothbrush longer than I should have. And everything, like I felt like going out and talking to people and not being a hermit. Everything just started to dramatically change.
That's amazing. Yeah, and probably I would agree with you. One of the most difficult things about going through something like that is the mental, not so much the physical aspect of that. I felt like I was in a mental prison every day, and I just couldn't get out of it. And it's an invisible injury that you look healthy on the outside, but
Yes.
you're absolutely dying on the inside. It's tough to communicate with friends and family. It's tough. And people are just like, go see a psychiatrist and talk it out. And you wouldn't have half of these problems if you felt good. So,
That's how I ended up trying 5 or 6 different medications, right? Well, it must be
yeah.
in your head. You need something to calm you down or lift you up or whatever the case may be, but wasn't the problem at all.
Did you notice any side effects going on any of those medications? I remember one time the antidepressants actually made me more suicidal. One time they worked, and then another time they were really not working. I felt worse.
I think the only Zoloft is the one I stayed on the longest. I hardly remember the other ones other than I don't think anything happened. I
Hmm.
know on Zoloft, I probably gained 30 pounds.
Yeah.
Um, no, I was just a zombie and flat. And I wasn't so worried about the things that were bothering me before, but I didn't really care about anything else either. I would just kind of sit in a chair and stare and maybe watch TV. And that was it.
So, Dr. Lee, you're at the 4-month mark of treatment. Your life is changing. Where do you go from here?
Well, my next thought was, well, this is the greatest thing that anybody ever came up with ever, right?
Yeah.
That was my next thought. So what am I? I'm probably in the eighth quarter then, right around that eighth quarter. I'm in probably sixth quarter. So it's not too long till we're going to get in the clinic. Number one, I was pretty excited that I was going to not fail out of school and I didn't feel like death all the time. And then I started thinking, okay, this worked this well for me, but Dr. Rush has been in practice for 35, 40 years. He's unbelievably good. Could I actually do this myself, right? Is this reproducible for me who doesn't know anything yet and never adjusted anybody? So I started doing the best I could to learn, and I would grab anybody that came along. Dr. Hillpish, I'm sure you know
Oh
Dr.
yeah,
Hillpish.
I love Dr. Hillpish.
his daughter was in school a couple quarters behind me. I'm sure he tried to hide from me anytime he saw me in the hall because I grabbed him and pull him in a room and start asking him questions. But I wanted to know what was I supposed to be doing.
Oh, he was teaching down there?
No, he would just come visit her.
Oh, gotcha, gotcha.
And then I would hijack him and jerk him off into a room and start pelting him with questions.
That's
So then I
amazing.
got into the clinic and I thought, well, if this worked this well, I'm going to do it. And I still don't know what I'm doing. You know, you're not very good, right? You're scared half to death to touch somebody.
Yeah.
But people would come in and have a problem. One guy came in and had this burning tongue, you know, burning mouth syndrome, right? For 20 years. I adjusted his atlas once and it went away.
Mm-hmm.
I don't even know what I'm doing. So
Yeah.
I thought, holy cow. Not only did this make sense, not only did it work for me, but apparently maybe I can do it too.
Amazing. Amazing.
So then as I went through the clinic, I mean, that was it, right? I just tried to improve those skills over and over and over. And we were exposed to a number of other upper cervical techniques and nothing wrong with them. But I think most people gravitate toward Blair's the thing that worked for me.
Right.
Now I'm a much bigger fan of the Blair philosophy in general, but Blair was the thing that worked for me. So that was, of course, the only way I wanted to go when it came to my own practice.
Absolutely. So you graduated from school, and then did you go right down to Florida? Are you from Florida?
No, I'm from West Virginia.
West Virginia. Okay. Did you go right down to Florida, or did you go somewhere else?
No, there was lots of moving around. I went to Tennessee first. I've been several places. I was in Florida once, came back, but I've been in this office now for almost 5.5 years.
Very nice.
And now I'm nice and settled in.
Very nice. And so what do you see in your practice, Doc? Do you see a lot of similar cases as you? Do you see a lot of post-concussion, Meniere's stuff, vertigo, a lot of unexplainable issues where people have been wrote off and they start to get better?
Absolutely. You know, the most common thing is somebody sits over there and says, I've had brain scans, I've had MRIs, I've had CT scans, I've had nerve studies, I've had this, and I've had that. And all of it came up negative, right? There's nothing, they can't find anything wrong with me. And then, like you said, right, sometimes it almost gets to the point they told me to go to a psychiatrist or take some meds because they can't seem to physically, they don't see a tumor, they don't see a hemorrhage, they don't see some big giant thing. And nobody knows what's wrong with them. And this is unfortunately the last stop. It'd be nice if it was the first stop, but yeah, it's tons of those things or tons of conditions that they can identify. Like you mentioned, Meniere's, right? I see a ton of those.
Right.
They identify it. They don't know what to do with it.
Exactly. It's like, what do we do now?
Yeah. Let's take a little meds. Let's try to not eat any salt. And then I'm still miserable all the time or, you know, whatever the case may be. But yeah, you get tons of that kind of thing.
Dr. Lee, would you consider Dr. Perry Rush a mentor of yours?
Oh, absolutely.
What were some of the big takeaways you've learned from him?
I think one of the biggest is that guy started practicing. I might have the dates slightly wrong if he hears this, but maybe like 1977 or somewhere in there. So when I started going to him, that would have been 2006. So let's call it about that, right? Decades of that. And I think every single day that guy was down there practicing on his headpiece to get better. I'm still going to get better. I'm still going to get better. I'm still going to get better. I think the two biggest things were that, and I never saw him cut a corner, right? Not taking it.
Yeah.
It's very easy. With cone beam CT now, it's much easier, right? It's hard to take a bad film. You have everything there. But back when it was Blair and you had to mark all the points and do everything else, that guy probably could have lined somebody, taking that many x-rays and that good, he probably could have lined somebody up and shot a film and 9 times out of 10 hit it anyway. Marked every single point, never cut a corner anywhere. Your care was as textbook and as straight through as it possibly could have been. And everybody got that, right? He didn't rush, he didn't hurry, he didn't do any of those things. It was piece by piece to make sure that everything was done exactly right. And then the adjustment was practiced a million times so that he could deliver it as best as he possibly could.
I was interviewing Dr. Lenars a few months back, and tell me if you agree with this. He said he's 30 plus years into practice, and he says he's better now than he was 5 years ago, 10 years ago. The guy is just so amped up to be in practice, and he still loves it just as much as he did 30 years ago.
Oh, I think so. And I think partly from a personal standpoint, once you learn what you're doing and you get financially straight at the beginning, you're clawing, because let's be honest, at the beginning, you got to make money too, right? You got to live. Right. And trying to get people in the office and trying to build a practice is stressful. Mm-hmm. And I think a lot of that, it's hard for it to not detract from your love of taking care of people, because you're so busy trying to take care of an office, your family, whatever that is. And the longer you go and the more stable and all that's stable, now you don't have to worry about people coming in. You don't have to worry about finances. You can get right back to loving what you do. And I mean, I would agree. The better my practice has gotten, the more excited I am about taking care of people, because all those other things to some degree take care of themselves.
Dr. Lee, how long did it take you in your experience to feel like you were fully back and healed? Like how many, like I know with the 4-month mark, you've almost felt 100% better, but
Right.
like, I remember it took me probably about 1.5 years to like look in the mirror and be like, I am better than I ever was. Every couple months, something would continue to get better, but it was
I
a
was
long
going to
shot back
say,
home.
I would say close to 2 years
Yeah.
before there just felt like there was nothing, right? Everybody's got
Yeah.
a bad day, but to
Yeah.
where all of those things just, to where, you know, stressful events in general, right? Whatever that kind of stress is, will trigger your weaknesses. And
Hmm.
at the beginning, those were, even when I felt pretty good on an average day, if boards were coming up or something else, it would trigger the weaknesses and things would kick in. But yeah, I would say 2 years. And then I felt, you know, almost bulletproof again and back to feeling like I hadn't for many years. I mean, I'm 47 now and I feel infinitely better than I did when I was 27.
And what is it about? I mean, a lot of people people have no idea what upper cervical chiropractic is. What is it about upper cervical? If you're explaining it to patients or somebody is watching this for the first time, what is it about upper cervical that works?
I have two go-to explanations, right? You've got your brain up here. The brain decided you're going to put those glasses on, that shirt, you're going to get this microphone. The brain stem that comes down into these top two bones controls everything else, right? And
Hmm.
that everything else is a lot more important than what this is doing. That's a
Hmm.
simplistic explanation. Naturally, the brain does more than that. But if that brain stem has pressure on it or it's not functioning properly, that's why, you know, you put 10 people in a room that have an upper cervical misalignment, and you very likely may have 10 different sets of symptoms.
Hmm.
Anything in the world can be affected. And it's why you do just keep checking boxes off. And, you know, we're looking for millimeter little misalignments, right? 1 or 2 millimeters can wreck your life. I didn't have
Yeah.
that big of a misalignment. No, I had a messy neck.
Yeah.
But if you looked at my C1, that Atlas misalignment, I mean, where's my camera? That thing was probably this big. Something
Mm.
this big had completely, utterly ruined my life.
Wow.
That's the key, right? You release that pressure. The thing that controls who and what you are and what you do now can start to function. Your body can start to heal as it was designed to do. I mean, that's the magic, so to speak.
Yeah. And I think the other magic part about it, what you were kind of touching on before, is the holding. It's like when you're going through everything you went through, the last place you want to be 3, 4, 5 times a week is a doctor's office or getting your neck cracked every single time. It's a
Absolutely.
it finally, like, it puts the power back in your hands to heal yourself, what you desperately need.
But it does. I always tell patients, if every single time you come in, we have to adjust you, we're just back to mechanical and we're a hamster on a wheel. If that pressure is what got you in trouble and it only stays for a day or two, we're not getting anywhere, right? You have to holding is healing is the old saying, but you have to hold or you're never going to get there.
Yeah. Yeah. And I was just looking at your book here, chapter 10. How long does it take?
I always tell people, right, when I first, this goes back to when I first started, you feel like you got to kind of answer that. When people ask me now, how many visits do you think it'll be? How long you think it's going to take? I don't know.
Yeah.
Everybody's different, right?
Yeah.
There's a small group of people, I always call them light switches. You adjust them and boom, it's like you flipped a switch and things they've had their whole life just disappear overnight and it's unbelievable. The rest of us, and that's certainly, you know, based on my story where I was, it's a gradual climb up. I don't know how long it takes. It took me many, many years to get sick. It wasn't going to take me a day or two to get better.
Hmm.
So who knows, right? I mean,
Absolutely.
we all know if you clear an atlas out, generally things start to improve at some point to some degree. You know, maybe they're not the big flashy things that you were hoping for on day one, but it takes as long as it takes.
Yeah.
I don't know how fast somebody's body heals versus somebody else's.
Yeah. And the question that we've all gotten so many times too is, why don't I know about this? Why is there not so many people doing this? Why do you think there's not a lot of Blair upper cervical, or it's growing, but why do you think there's not a lot of people doing the upper cervical work?
I think part of it, no, I haven't been around schools that much for years, right? But I know when I was in school, a number of schools didn't teach it. Tons didn't teach it. We were at an Irene Gold board review, I think in Atlanta, and I went to lunch with a bunch of people and I didn't know half of them. And everybody's going around because we're getting ready to be done. I'm going around the table. What kind of practice are you having? What kind of practice are you having? And I remember it was a guy, I think from Texas Chiropractic College. I said, upper cervical. And he looked at me and said, what's that?
Yeah.
I was baffled because I went to Sherman where you taught where that was very brought up and very talked about.
Yeah.
I think that's part of it. I think it wasn't taught enough. But even within that, a lot of people in my class and a lot of people around me heard it and they didn't do it. And I think sometimes from both a practitioner and a patient perspective, it seems too simple.
Mm-hmm.
Right.
True.
I mean, if you go to a big hospital system, right? Multi-million-dollar equipment, all these doctors, very smart people, all these experts, $1 million MRI machines. Nobody could find anything wrong with me. You're telling me that little Dr. Lee over in his little office on that little black table he's got, he can do a little thing that nobody else did and it's going to heal me? That seems too easy sometimes. And I think it seems too easy from a practitioner standpoint.
Yeah, it's so far out of our health paradigm. It's like, what, he touched a bone in your upper neck and you started to heal.
Right.
It's tough for people to grasp, I think.
I think it is. And I think on the doctor side of things, I think it was Kirk Erickson, if and it's not, I apologize, that made the comment that it takes some guts to tickle somebody behind the ear, leave them alone and tell them everything's going to be all right. I think sometimes that's true, right? That I'm going to adjust your atlas and your heart problem is going to go away. Mm-hmm. Now, I don't necessarily say I'm adjusting an atlas for a heart problem, but I'm adjusting an atlas, your body's going to work right. Potentially that will get better, but I think, I'm not sure everybody can buy into that. It was easy for me because I had such a personal experience.
And that's one of the most important things in our work too, is knowing when to leave it alone. Because if you give that adjustment they don't need, you're going to ruin everything. How do you know when to leave that alone, Dr. Lee?
So why you got to have objective testing, right? Like I'm huge on the scanner and thermography, leg checks and other things. And like BJ always said, when in doubt, don't.
Mm-hmm.
I remember one time in practice, I'd been in practice maybe a year and a half. This poor girl came in with such bad sciatica that her husband had to carry her in the door. She was bawling, crying. I adjusted her, and within like 3 days, the sciatica was gone. Mm-hmm. She was good for almost 8 months. Mm-hmm. She came in one day. I could not clinically say she needed an adjustment, right? The scan didn't look like she needed adjustment. The leg check, all of it wasn't off. But I felt so bad for her because she was being carried again. She's crying so much. Mm-hmm. And I'm taking my head and saying, okay, this is exactly how she was symptomatically the last time. Maybe it's just showing different, right? It's been a while. And I adjusted her. She never got better under my care after that. She had to go have other things done. I'd probably been in practice a year and a half ago. And unfortunately for her, that's how I learned my lesson. That was the one big moment for me that held up with the in and doubt, don't. Worst case is she goes, she's mad at me or whatever, or thinks I didn't help her, but at least I didn't make it worse. Right.
Yeah. 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 I think that's why it's so crucial to stick with the upper cervical work as a doctor for 5-10 years, because you learn so much. And, every upper cervical doc has made that same mistake, and you learn from it.
You do. And hopefully it doesn't take too many times to learn. But I mean, what's the worst case? You don't adjust them today. You tell them to come back in a day or two. Because look, I'm not sure. The tests aren't clear. We don't want to do anything that's going to mess you up. Come back in a day and we'll see how it sits.
Mm-hmm. How do you find the healing cycles go? That famous upper cervical chart, first 6 weeks is up and down. Then you hit a rest phase, 3, 6, 9 months. Do you find that to be true?
Probably for the most part, but I think, everybody's trauma history, do they eat clean? Do they eat junk? Are they on 10 medications? Are they not on 10 medications? How much does your body have to fight through to heal, right? If you come to me, you're on no meds, you eat really clean and you exercise, the chances are your body's going to heal faster than if you never move, you take 5 drugs and you eat junk all the time, right?
Yeah.
I think all those factors will play with it a little bit.
Is there any recommendations you give your patients under upper cervical care that they can implement where you find them stable and you say, all right, you can start addressing other things, whether it be diet, exercise, anything like that?
I do to a point. I mean, yeah, like the initial recommendations are here's the things to watch out for doing, right? And then once we get
Right.
stable, depending on what their problem is, maybe it's postural exercises, maybe it's throw a few supplements in. If they eat junk right on, if I ask them, how do you eat? And they say, well, I eat terrible. And I say, well, you're going to feel terrible, right? It's
Yeah.
hard to heal eating Twinkies all day.
Yeah.
You give some advice that way and make sure you drink enough water. Your body needs, if I'm going to regenerate and heal things, I need the proper fuel to do so.
What are some of the recommendations you give after, especially a first adjustment, and for how long, like things not to do to help you hold that adjustment?
I mean, the first question I ask everybody afterward is, what position do you sleep in? And if they say I sleep on my stomach, then already we're not going to be friends, right? We've got to fix that. We've got to have better posture when we sleep. Do you work at a desk all day? Yeah. Do you lean way in? How do you sit? It's more of those things. Don't make great big head movements. Lord knows the bane of our lifetime is having a phone and having your chin tucked down, right?
Yeah.
If you tell somebody I can do the best work ever done up here, if you're sitting around with your phone 20 hours a day down, it's hard for it to hold.
Mm-hmm.
So a lot of postural, right? Just be careful where you are and be aware of where your head is, because a lot of people are not. If they've had terrible neck pain, they're obviously already aware of it. But if you come in with so many other things, you've got to be somewhat conscious of what you're doing.
And what if somebody's like you or when you were 19, big power lifter, they want to get back into the gym as soon as possible? What are your recommendations for that?
I usually tell them initially nothing overhead for the
Yeah.
first 2 to 4 weeks, especially because this movement puts strain on the neck, right? Let's watch out for that. Stuff that's more in this plane, like a bench
Mm-hmm.
press or a row, the body handles better. It doesn't really put strain on the neck. I don't tell people to not do anything, because if you're
Right.
used to moving and then you don't move, you're going to feel terrible. And your
Right.
body needs movement just like it needs good food to heal up.
Mm-hmm.
But back everything down a little bit and let's cut some certain things out so that we're not straining the neck. And if you usually run, don't run, go for a walk.
Yeah. I like that.
Yeah, I'm not big on being told not to do things anyway. So I
Yeah.
try to not say don't do anything, because people don't like that either.
Yeah.
But if every time you golf, you can't walk for 3 days, now we're probably not going to have to golf for a bit till we get this thing healed up. And then maybe go hit a bucket of balls right at the driving range.
Yeah.
Okay, that was pretty good. Go play 9 holes and let's progressively build back up. I mean,
I like
part
that.
of the
Yeah.
reason of getting better is so you can enjoy your life and do the things you want to do, but we got to figure out the smart way to get back to those things.
I like that. Yeah. Cause you get a lot of, young athletes, even guys that, like you said, that they love movement. They love working out. When you just tell them not to do anything, they just get deflated. And I feel like that can interfere with the healing process as well. So, I like how you can gradually, take it easy for a little bit, stay away from the overhead activity, and then
Yes.
we'll get you back to doing what you love to do.
Yeah, because it does deflate, right? Not
Yeah.
only now do I feel bad, now you're telling me I can't do anything.
Right.
Now I'm not enjoying this process at all.
Right. Right. Absolutely. Dr. Lee, I know you have, you're getting back into your next shift here soon, but, where are you located and where can people find you and make an appointment with you?
I'm in Fort Myers, Florida, sunny Florida here. Very few hurricanes, so you don't have to worry. UpperCervicalFortMyers.com is the website. That's the easiest thing. Go in there and find the phone number or click a button, and you can fill out a form and we'll call you, or you can email in. That's the easiest thing.
Awesome. And at the end of every episode, I like to ask all my guests, what is one piece of advice that has really resonated with you over the years that you would like to gift the audience? Could be absolutely anything.
From the doctor perspective or the patient perspective?
Anything. You can do one of both if you want.
I would say from the patient perspective, I like that this podcast is called Expect Miracles, right?
Mm-hmm.
Expect the miracle, don't expect it today.
Yeah.
Maybe it's going to come today, and maybe it's going to come in, like we both discussed, right? Months down the road. Our results, I'll never claim it's 100% of every patient got better, but it's almost all of them got better. Maybe they get 100% better, but they got drastically better than they did when they came to me, right?
Mm-hmm.
And I think from the doctor perspective, I shot a Facebook Live this morning. I think so. You and I, and a lot of upper cervical doctors have a great story about what got them better. But when you've been the sick person sitting in the chair over there, and now you're on this side of the desk, I think it's much easier to identify with what they're dealing with and listen to them and let them be heard. The
Mm-hmm.
reality is, when you practice this way, they could be a mute, they could never fill out a form, they could tell you nothing, you could go through your process and you could get them better. But people like to be heard. I wanted to be heard.
Yeah.
Even knowing that now, I still don't want to walk in and never say a word, right?
Yeah.
Listen, have some compassion. And if they get frustrated, understand they're not frustrated at you. When I was early in practice and somebody wasn't getting better and they asked me a question, I freaked out, right? Like, oh, they're
Yeah.
unhappy with me. They're unhappy with this. No, we all want to get better. We all want to get better faster.
Mm-hmm.
Nobody's coming at you and saying you're not good at your job. They're just frustrated that things aren't getting better. So just like the patients need to be patient in getting better, the doc needs to be patient in understanding that they want to get better faster.
I agree. And Dr. Lee, is there anywhere people can get this book?
Amazon. If you go on
Amazon.
Amazon, you can order the hard copy, or the Kindle version is on there as well.
Yeah, so anybody listening to the podcast that wants to dive a little bit deeper into Dr. Lee Engel's story, the book is called My Dirty Little Secret, and you can find it on Amazon. So Dr. Lee, thank you so much for coming on. I really appreciate your time. Your journey back to health is phenomenal. You're helping so many people get their lives back under upper cervical care. There is nothing better in my book. Thank you so much for taking the time and being on the show.
Oh, you're welcome. And if I can throw one more thing in, I'm looking for an associate doc to help me get more people well. So if anybody's listening, you'd like to come to sunny Florida, shoot me an email, drleeengel at gmail.com, and we can talk.
Beautiful. That's a
Thank
great
you very much
opportunity.
for having me.
Great opportunity for any chiropractic students or any doctors that want to do the upper cervical work. So Dr. Lee is hiring, and yeah, hit him up if you are looking for an associate position. Dr. Lee, thank you so much for joining us. I'll be in contact, and yeah, thanks again.
Awesome. Thank you very much for having me.